All right, welcome everybody. We're doing all staff a little bit differently for the month of January due to our COVID-19 outbreak, GI outbreak. So we are limiting individuals, so we're not having touching and that's needed and necessary. So hopefully everybody can hear me. We have a lot to cover today. We're going to be going over infection control practices, abuse, resident rights. We also have some housekeeping items as it relates to dietary and what we call IDDSI. And also we are going to be going over Code White as we are anticipating experiencing inclement weather this coming Saturday. So we are putting plans together for that. So I'm going to share my screen. We are also going to be posting this video on YouTube. So with that, we are going to present first Charity Garcia, our infection control nurse. So go ahead, Charity. All yours.
What I want to review is just some brief things about our PPE and our hand hygiene so that we're all remembering the most important parts of prevention. Every one of us is an infection preventionist as we go through our day. Requirements putting on and taking off or donning and doffing PPE. I want to make sure that everybody's signed their competency, so we'll be going through making sure they get handed out. There's a procedure and a process to the PPE when you're going in and out of rooms that might be infected. Those procedures are on the signage that's outside of the door. There will no longer be bins at every single door that has a sign. So I would like people to please be looking for the signage and then find the bin that has the appropriate gear in it. Don't forget that when you go into an infected room such as COVID, that you must wash everything as you're coming out of the room. Your N95 must be taken off and thrown away. Your shield must be either sanitized so that you can rewear it, or you have to have an alternate shield. And your hands must be sanitized in between every step. The one thing that prevents the spread of infections more than anything else is hand hygiene. What I'm not seeing a lot of is hand hygiene. Some people are forgetting as we're going in and out of doors that we must wash our hands before we go in every single room. We need to remember that every time we apply a pair of gloves, we wash our hands first. When we take them off, we wash them again. When we are passing trays in and out of rooms, this is the best way to infect the entire building by not washing your hands appropriately. So if you'd like to stop the spread of these things, then you need to make sure you're washing your hands before you touch a tray that goes into a resident room. And when you come back out of that room, you're washing your hands again. The state will also be looking for these things. And those are what we call low-hanging fruit. It's an easy tag. Nobody wants to be the reason why we got a tag. So watch what you're doing while in the hallway, specifically for the care of the residents, but also because we want to make sure we're not letting the money that we've earned in this building to better everything that we have go straight out to the state because they've tagged us. Easy peasy. So wash your hands. Every time you touch your mask, your face, or your shield area, all of this, the droplets out in the room out that you're in are now all over this. Wash your hands. You don't want to give that to somebody else. If you're like me, you touch your mask and then you rub your eye. That's how I'm going to get sick if I don't watch what I'm doing.
Would hand sanitizer be adequate for that as well? In that particular case?
In that case, yes, hand sanitizer is adequate. Where we want, that's the next thing I'm gonna talk about. Where we want to use soap and water is any time that we're handling residents' care, you're dealing with a brief, you're handling a urinal, you're going into the bathroom for them, you're assisting them in the bathroom. That is a soap and water only wash. You can sanitize after if it makes you feel better, but you must wash with soap and water. I will be looking for that, state will be looking for that, and other managers will be looking for that. We need to get everybody back in the good practice. We're all burnt out and we're tired, and I get it. Washing your hands is the one thing that you don't want to break down on. If you're dealing with people who are having vomiting and diarrhea, that's the other thing, enteric rooms, you must go wash your hands with soap and water every time that you come out of those rooms. Please don't forget, lastly, surfaces. Things live on surfaces for a very, very long time. So while we are de-isolating people with COVID, the surfaces in their room are not yet clean. So watch out for what you're touching. Make sure that you're not carrying it throughout the building, and housekeeping, we will be working as quickly as they are able to. Please remember, they are only human beings and they can only work the number of hours that they're given. So we're going to try and help them out by making sure we clean as we go.
Is there anything else that you wanted to cover from these documents, or did we already pretty much explain?
Pretty much explained it. I just need them in front of my face so I could remember. I'm not gonna go over step by step. That'll take me a half an hour.
Okay, so they can see dawning and doffing and they know where to locate things.
Yeah, I'd like them to read that, and that is something that they do on Relias as well. So there's really no excuse.
All right. Give me the copy of the resident rights. So we can. All right. So we're gonna review resident rights. Resident rights, you have the ability to see these rights. These rights are posted throughout the facility. They're also in the admissions packet for the residents. But the resident has the right to have a dignified existence, be treated with respect, kindness, and dignity, to be free from abuse, neglect, misappropriation of property, and exploitation, be free from corporal punishment or involuntary seclusion or physical or chemical restraints, not required to treat the resident's symptoms. Self-determination, communication with access to people and services both inside and outside the facility. Exercise his or her rights as a resident of the facility and as a resident or citizen of the United States. Be supported by the facility in exercising his or her rights. Exercise his or her rights without interference, coercion, discrimination, or reprisal from the facility. Be informed about his or her rights and responsibilities. Appoint a legal representative of his or her choice in accordance with state law. Revoke the delegation of a legal representative in accordance with the state law. Exercise rights not delegated to a legal representative. Have his or her same-sex spouse, if applicable, afforded treatment equal of that of an opposite-sex spouse. Be notified of his or her medical condition and that any changes in his or her medical condition. Be informed to participate in his or her care planning and or treatment. Access personal medical records pertaining to him or herself. Manage his or her personal funds or have the facility manage his or her funds if he or she wishes. Manage his choosing or and attending physician and participate in decision-making regarding his or her care. Privacy and confidentiality. Voice grievances to the facility or other agencies that hear grievances without discrimination or reprisal, without any fear of discrimination or reprisal. Have the facility respond to his or her grievances. Examine survey results, communicate with outside agencies, example, local, state, federal officials, state and federal surveyors, state long-term care ombudsman, protection or agency organizations, etc. regarding any matter. Work or not work. Perform services for the facility if he or she chooses or refuse to perform services for the facility. Visit and be visited by others and outside the facility. Be informed of safety or clinical restrictions or limitations of visitation. All right, this is our code white policy, also our inclement weather policy. So we are anticipating inclement weather to be having occurring this coming Saturday, possibly through Tuesday. We are putting out information regarding staffing. What we want to reiterate is that we all chose to be in long-term care. That means that we chose to be here, and that means coming up with ways so we can take care of our residents. So what we're asking for you to do is to come up with a plan A or a plan B and let us be your plan C, but please exercise your plan A and plan B to get to the facility before you request plan C. We will be here on site. We're going to be putting out the icer. We'll have snow shovels. We will be available and we will be communicating. Carson, did you want to talk about the notice of transfer?
Yes, it is now being required that anyone who is being re-hospitalized has to have a notice of transfer form filled out by nursing before they leave, as well as the bed hold form. These are being directed by the state, and they are also being flagged if they're not being accomplished by the state when they come in for surveys. So we have put these out on the floor for the nurses. We're just encouraging everyone to make sure that they're documented and placed appropriately. This is now the process that is moving forward to ensure that patients have the rights to return and with their transfers. Okay, and our next thing is abuse and neglect. This is the protocol that is for Avamere. Definitions: abuse, willful infliction of injury, unreasonable confinement, intimidation, or punishment resulting physical harm, pain, or mental anguish, or deprivation of goods or services. This abuse can take the form of verbal, sexual, physical, mental abuse, or can enable through the use of many different mediums such as technology. Neglect is the failure of the facility and its employees or service providers to provide goods and services to avoid physical harm, pain, mental anguish, or emotional distress. Sexual abuse, by definition, non-consensual sexual contact of any type with a resident. Willful abuse, the individual must have acted deliberately to inflict injury or harm. The responsibility of the facility in the results of abuse is always to know care plan of interventions, encourage venting or frustrations by the residents, allow staff members when able to switch sections if a resident is to be complaining or a problem. Ask staff to assist with a difficult client or encourage to break the a break for the employee with excessive frustration. Provide in-services at least every 6 months, which is what we're doing today. Notify the licensed nurse immediately if resident indicates fear of staff, family members, visitors, or other residents. Always report inappropriate behavior to staff, visitors, or other family members or other residents. The responsibilities of the staff will be that we do investigation, we do immediate reporting, and we identify the risk factors, and we identify the situations that are taking place, and we take appropriate actions. We investigate, we address the needs, we support and report.
Question, here's a question for you, is me being the interviewer, who in this building are mandatory reporters?
We all are, all nursing staff, all medical staff.
Did you hear that? So all of us, whoever wears an Avamere name tag, Avamere Rehabilitation of Oregon City name tag, we are all mandatory reporters. All right, you ready to proceed?
Yes. The next thing we have here, this sheet typically would be colored in red. This comes on all dietary meal carts. And this is to identify that all menus that go into the patient's rooms need to be in a plastic sealed wrap so that the patient can handle it and make their decisions for their menus. The nurses or the staff are then the ones who record that. When they remove the plastic bag from the facility or the room, they are to wipe it down. This is why it's in the bag. Then they can actually take the menu out, fill it out, place it back in the bag, and it goes back to the kitchen in the sealed bag. This is to prevent spreading of infection to the kitchen or to other areas of the facility. This one's upside down or sideways. Okay, so I have posted laminated vital sign cheat sheets throughout the facility by each one of the kiosks that the CNA's chart. This is a guide to normal vital signs. We are finding that often vital signs are not being taken appropriately. We're not getting appropriate vital signs documented. And we need to make sure that we are following the process so that if a patient has an inappropriate temperature, pulse, blood pressure, oxygen saturation, or respirations, that it's being documented appropriately and that the nurses are being notified of the inappropriate vital signs. We have also placed at the front desk for the nurses to check a vital sign and weight check sheet that will be then hung at the CNA station around the corner from Hall 100. And that checklist will provide staff the knowledge of which patients need daily weights and vital signs, so that you can also document in your POC. We will be having Kaiser eventually. Dr. Takano will be giving a presentation at some point in time in the future on appropriate vital sign taking and monitoring. She was not available today due to other timing conflicts, but Kaiser is very concerned with maintaining appropriate vital signs and management. We have also put out at the nurse's desk, as well as to each one of the RCMs in their offices and to the admission nurses. This is the cheat sheet or crosswalk, whatever you'd like to refer to it as, that for Kaiser residents, when they have diet orders written, this is how you would cross it over to where it would be effective for the ITSE, which is the standard of dietary orders for our facility. So on the left side, you have Kaiser's texture orders, how they would write their orders. And then on the right side, you have what the equivalent of how we are to convert that into our ITSE orders. And so this is provided to everyone so that we can effectively get those orders correct. This is part of our PIPs in correcting and ensuring that our diet slips are correct when they go to the kitchen. Okay. At the end of it. Oh,
All right, so we can't thank everyone enough for managing this outbreak, COVID-19. And I know, just like many of you, this was 3 holiday seasons in a row that I spent in N95s, and I recognize that it's not easy. We did a good job and we did it together. So again, I can't thank you enough for all those people that really helped out in many different ways, picking up shifts, working overtime, driving people in, whatever was needed and necessary to make sure that the residents were taken care of. So thank you. And nobody expects to have a COVID-19 outbreak at the same time that you have a GI outbreak. I'm just grateful and thankful that the inclement weather is now coming this coming week versus it would have been this past weekend. So it is a group approach in order to do this. No one said that long-term care was easy, but somehow long-term care chose you if you're watching this video. Some updates. We will be rolling out the relay system. We just been waiting for the outbreak to get over. We have moved the CNA station from out of the nurses area and over onto the cubby on the 100 side. Relay will be rolling out. We did get the update for the call light system. We have rolled out our Telsure, which is communication not only with Kaiser, but also communication with DEA. And DEA did agree that when they put in orders, they will also be messaging on Telsure to alert that we have a new order that needs to be pulled. So this is all good things and working on it together. So we also upgraded our thermostats, so we have the ability to control our thermostats remotely. That's going to be a huge help moving forward. We do have a new Hoyer that we are just waiting. Unfortunately, it came from the manufacturer and it didn't come with a pin. So we are looking at getting a pin from the manufacturer before we put it out on in safe operation on the floor. So for the month of January, it's hard to believe, right? January of 2024, We talked about strategic plan in 2023. We rolled it out in 2023 for 2024. Now what are we gonna do with 2024? What we're claiming is that 2024 is the year. Everybody has gone through so much growth in 2023. Let's all hold ourselves accountable and claim stabilization for 2024. I don't know about you guys, but I really want stabilization for 2024. So that's what we're claiming. That's what our expectation is going to be, is that we're going to stabilize. We do have programs that will roll out from Avamere Living. I know there's an update that's coming regarding briefs. Briefs will no longer be provided by Medline. They'll be provided by Prevail. We're probably about 2 to 3 weeks from a complete a rollout. We just had the first call on that today. Ben, can you think of any other updates that I potentially have missed that would be significant for our staff?
I want to bring up that we have
Okay.
on our Cubex tower, it is at capacity. And because it is at capacity, Farm America has provided us 2 e-kits. One is an emergency e-kit and one is an added medication e-kit, as well as they have provided us an IV tote, which has IV supplies and IV solutions in it. Those are kept in the med room.
Okay, so anniversaries for the month of January, we have LPN Aaron Ote. And it looks like I have to do basic math, not the best at basic math. Don't tell anybody, please. Looks like 7 years, 7 years of seniority. And then we have Jeff Wilson, who has 2 years of seniority. Our birthdays for the month of January, we have Denise O'Brien. We have Pauline Kozachev. We have Nora Goodman, Purity Maria, Amanda McCauley, Sadie Garcia, Stephanie Salmon, and Jody Fugate. Our shining star of the month that was voted for by our residents, even though we didn't have a resident council in person, still the activities director goes room to room, and that person that was chosen by the residents is Mary Taylor. So Mary Taylor is our shining star of the month for the month of January. And the Employee Appreciation Committee, the person who was voted for by you, this was voted by you, because they show up as votes that show up in my box, and also from the Employee Appreciation Committee. The person that you have chosen is someone who has returned to us, was here previously, came back, is now really being a true anchor for the weekend. I had the ability to work with that person for almost a month now, and I can attest that the commitment for this individual is at a very high level, and only wanting to grow and only wanting to be a part of something, and recognize that maybe the grass wasn't necessarily greener on the other side, but came back and returned. And that person for the employee of the month for the month of January goes out to Sadie Garcia. So thank you, Sadie, for all that you do. Thank you, Mary Taylor, for all that you do. And hopefully our goal is that we will be out of this outbreak, and we will have our February all staff, and we will have that in person. We do have upcoming, I feel like a news anchor almost, like doing this right now. January the 17th is a general orientation, provided that we could have that in person. So again, thank you, everyone. We appreciate everything that you are doing to make this work in a most difficult and challenging times.
And there will be a sign out sheet for watching this video at the main desk. Please sign it when after you view the video.